Good morning to the Makah community. Today is Friday, August 6, 2021. This is the Makah Tribe's COVID-19 pandemic response update. My name is TJ Green, chairman for the Makah Tribe. This message is brought to you on behalf of the entire Makah Tribal Council, Vice Chairman Patrick DePoe, Treasurer George Chad Bochop, Councilman Keith Johnson Sr., Councilman Nate Tyler. We have had a significant increase in COVID cases and exposures here in Neah Bay. Many of these cases are linked to residents who traveled outside of Neah Bay and then had close contact with others when returning home. There have also been increasing COVID cases in Clallam County, Washington State, and throughout the United States and Canada. This spike in cases is directly connected to individuals who have not been fully vaccinated against the COVID-19 virus. As a result of these changing conditions, the Makah Tribal Council has approved Health Order 0521, enacted by Resolution 86-21 on August 3rd of 2021. So what has changed with this new order? The Makah Reservation is now in phase 2 of the Makah COVID-19 public health protocols. We've moved from a phase 4, which is our least restrictive phase, to a phase 2, which has a number of limitations in it. Some of these include indoor gatherings are prohibited except for the assembly for the purpose of cultural and religious practice with an approved safety plan at 25% building capacity. Outdoor gatherings are limited to 10 people, except for the assembly for the purpose of cultural and religious practice with an approved safety plan. When a Neah Bay resident returns from travel off the reservation where they had close contact with others, they must do a preventative quarantine for 14 days. Preventative quarantine means that you only leave your home for essential and safe activities, and that you physically distance yourself from anyone outside your household group, staying 6 feet or more away and wearing a mask. If everyone follows the preventative quarantine, we will avoid an outbreak here in Neah Bay. We can't emphasize this action enough. It is clear in these most recent cases that had individuals done preventative quarantines from the travels and activities that they did while off the reservation, that we would have a number of less cases if, quote, preventative quarantine protocols were followed. Excuse me, I'm just received a notice here, and we do have 2 additional cases that will be added to the numbers that I was going to share. So, these are cases that are linked to outside travel, and the people are already in quarantine. So we really can't emphasize this part enough. That a preventative quarantine is definitely something we need to do a lot better on as a community and as individuals when we travel outside of the reservation. If we go to a restaurant, go through an airport, engage in any gathering or activity off the reservation, such as sporting events and music festivals and things of that nature, those are all activities that when we return from them, if we choose to do them, I hope we think twice about doing that for the time being, and that when you do return home, please do a preventative quarantine if you engage in that type of activity. So personal visitors who are non-Makah and don't live in a household with an enrolled Makah tribal member are not allowed for the duration of this order. So let's talk about what a preventative quarantine is as compared to an official quarantine and official isolation. Preventative quarantine, when to do it? Anytime you've had close contact with someone outside of Neah Bay. Anytime you've eaten at a restaurant or flown in an airplane, you should be doing a preventative quarantine. So what do you do in a preventative quarantine? You stay home for 14 days, except for essential and safe activities. Going to work is okay. Follow your workplace safety plan. And here at the Makah Tribal Center, part of your workplace safety plan, when you are around other co-workers and not behind a closed door, you must be wearing a mask. So masks are required as part of the Makah Tribal Council workplace safety plan. Let's make sure we're doing a better job. in all of our buildings out at the travel center and wearing this mask when we are not behind a closed door and by ourselves. Avoid close contact with anyone else outside of your household group. So those are things that you should be doing in a preventative quarantine. If you are in an official quarantine, anytime you're put in official quarantine, anytime you've had direct or close contact with someone who has known COVID. Once again, if you've been exposed to someone with a known COVID infection, you are notified and put into official quarantine, or you should take those actions yourself if you know that before you are contacted. And then when you're asked to go into quarantine by a public health official, that's means you're in official quarantine. What to do when in official quarantine: stay home for 14 days from the date of exposure. Do not go to work, to the store, or run other errands. And then official isolation: when to do it: when you've been diagnosed with COVID. If you're officially diagnosed with COVID, you'll be put in official isolation. You'll be given instructions. You stay home in accordance with instructions from the health official. Stay 6 feet away from others. When you can't do this, wear a mask even in your own home. And so what we want to do also is encourage our community. If you have friends or family members that are in official quarantine or in official isolation, please support them. Let's give them some positive support to keep themselves safe and keep the community safe by staying in quarantine and adhering to the protocols and to the directives by the public health officials. Let's do some contactless deliveries for their essential needs, food and medicines and things of that nature. Or deliver them books or things to read if they need some things to help pass the time. Use FaceTime and other social media to connect with those people in official quarantine and official isolation, and have some positive interactions with them in that manner to help them and keep their spirits up and give them the support they need to keep themselves and others safe. So, let's work to do that as a community. Currently right now we have 25 households that are in official quarantine or isolation. And we want to support those households and give them the tools they need to make it through, to keep themselves and everyone else around them in the community safe. We currently, we did at the start of this message, we had 10 active cases. Just been notified, as I mentioned earlier, that 2 more active cases are just added. So we now have 12 active cases of COVID in the community. Once again, the 2 new cases that we just received notice of during this message are people that are already in official quarantine, have already been isolated that way. Once again, that is also related to out-of-state travel. So we want to make sure that we're doing a lot better job with our preventative quarantine when we engage in those activities. That's an area we need to improve, as well as in the workplace. Here at the Makah Travel Center, we need to be wearing this mask when we're not behind a closed door and by ourselves. Since in the last 2 weeks, we've had, it was 13 cases. Now with the 2, it's 15 cases in the last 2 weeks. So that's pretty significant. It's a lot higher than any time throughout the duration of this pandemic. That some of the highest numbers we had in a month, I think, were 7 cases in a month last November, prior to what we're going through right now. It is positive to note that some of these new cases are people that are already in quarantine. Some of the testing was expected that these people are likely to come back positive because of their exposures. And once again, let's support those people in official quarantine so that we can make sure we contain that they they adhere to all that's being asked of them, and it's very difficult. But it helps keep everyone safe here in the community. Well, everyone, this has been a very tough couple weeks. The council just wants to thank you for everything that you are doing, but we also want to challenge everyone to do better and to hold ourselves accountable first and foremost. Take personal responsibility for any actions that we are taking ourselves, and to be honest with ourselves and take the proper measures if we do travel, if we go do any of those activities that have a higher risk, going through airports, traveling out of state, attending festivals or sporting events, that we take the preventative quarantine measures. As always, if you ever have any questions about your health, or whether have a concern about being exposed, you can call down to Sophie Tredovic Indian Health Center, talk to a provider or a nurse, and get scheduled to be tested and receive directions on how you should proceed. Everyone take care, be a good neighbor. God bless. Sure.